Therapy: How Modern Gender Theory is Failing Young Women. Author: Abigail Shrier. Year of publication: 2024. Published by Regnery Publishing. Introduction: Bad Therapy by Abigail Shrier is a critical exploration of contemporary therapeutic practices related to gender dysphoria, particularly focusing on the treatment of adolescents. The book delves into the dramatic rise in gender dysphoria diagnoses and the potential pitfalls of current therapeutic approaches. Shrier, a journalist known for her investigative work, argues that the current trend in gender therapy, especially for minors, may be more harmful than helpful. The surge in gender dysphoria diagnoses, Shrier begins by highlighting the unprecedented increase in diagnoses of gender dysphoria, especially among teenage girls. This surge is juxtaposed against the backdrop of a broader cultural shift towards greater acceptance of diverse gender identities. Shrier points out that while gender dysphoria was once a rare condition, it is now being diagnosed at alarmingly high rates. She attributes this increase to various social factors, including the influence of social media, peer pressure, and a general societal trend towards greater acceptance and exploration of gender identities. Critique of affirmation therapy. A central theme in Shrier's critique is the practice of affirmation therapy, which is prevalent in many gender clinics. Affirmation therapy involves accepting and supporting a patient's expressed gender identity without extensive exploration of other underlying issues. Shrier argues that this approach, while compassionate and well-intentioned, may lead to negative outcomes. She contends that many therapists and clinics are too quick to affirm a gender identity and pursue medical interventions like hormone treatments or surgeries without fully understanding the patient's motivations or the potential long-term consequences. Shrier presents evidence suggesting that affirmation therapy can sometimes result in patients undergoing irreversible medical treatments without sufficient consideration of the risks. For example, she cites cases where adolescents who transitioned to a different gender later regretted their decision and experienced significant physical and psychological distress as a result. Personal stories and case studies. Throughout the book, Shrier includes numerous personal stories and case studies to illustrate her points. These narratives often involve individuals who transitioned to a different gender in their youth but later experienced regret or complications. For instance, she recounts the story of young women who, after undergoing hormone treatments or surgeries, found themselves facing severe health issues or emotional turmoil. These stories serve to highlight the potential downsides of current therapeutic practices and emphasize the need for a more cautious and thorough approach. The role of social media. Shrier also examines the role of social media in shaping perceptions of gender identity. She argues that social media platforms have created environments where gender nonconformity is increasingly normalized and celebrated, which may contribute to the rise in gender dysphoria diagnoses. According to Shrier, these platforms can create echo chambers where individuals are exposed to affirming messages about gender transition, potentially influencing their self-perception and decision-making processes. She raises concerns about how this influence might lead some individuals to pursue gender transition as a form of social validation rather than addressing underlying psychological issues. Medical and psychological concerns. A significant portion of Bad Therapy is devoted to critiquing the medical and psychological aspects of gender dysphoria treatment. Shrier questions the scientific basis for many of the treatments offered to individuals experiencing gender dysphoria. She argues that there is a lack of rigorous, long-term research on the efficacy and safety of interventions like hormone therapy and surgeries. Shrier believes that the current standards for diagnosing and treating gender dysphoria may be inadequate, as they do not sufficiently account for the potential for regret or the complex nature of the condition. In particular, Shrier raises concerns about the use of puberty blockers and cross-sex hormones in adolescents. She argues that these treatments can have significant and irreversible effects on physical development and overall health. Additionally, she critiques the lack of comprehensive psychological evaluations before initiating these treatments, suggesting that more thorough assessments are needed to ensure that patients fully understand the implications of their decisions. Criticism of the medical community. Shrier's book also includes a critique of the broader medical community's approach to gender dysphoria. She argues that there is a prevailing bias towards supporting gender transition as a solution, with less emphasis on exploring alternative treatments or addressing underlying psychological issues. According to Shrier, this bias may be driven by social and political pressures rather than a careful evaluation of the evidence. She calls for a more balanced and evidence-based approach to treatment, emphasizing the importance of considering the long-term impact on patients' well-being. Advocacy for reform. In the latter part of the book, Shrier advocates for a reform in the treatment of gender dysphoria. She suggests that current practices need to be re-evaluated to ensure that they are based on rigorous scientific research and that they prioritize the well-being of patients. Shrier calls for more comprehensive research into the long-term effects of gender transition treatments and urges for a more cautious approach to diagnosing and treating gender dysphoria. She argues that a shift towards a more thoughtful and evidence-based approach could help prevent some of the negative outcomes associated with current practices. Conclusion. Bad Therapy by Abigail Shrier is a provocative and thought-provoking book that challenges the current therapeutic practices related to gender dysphoria. Through a combination of personal stories, case studies, and critical analysis, Shrier raises important questions about the effectiveness and safety of contemporary treatment methods. Her call for reform reflects a desire to ensure that individuals, especially minors, receive well-considered and evidence-based care. The book contributes to an ongoing debate about the best approaches to treating gender dysphoria and the potential consequences of modern therapeutic practices.